Okay.
Okay, Dr. Talaber, thank you for joining us today. You're from the Neurovision Therapy Institute, and if you can, give us a better idea on what got you into just where you're at with the neurooptometry and all that.
Yeah, absolutely. So I'm a double board certified neurooptometrist, and which means I specialize in vision therapy and vision rehabilitation. So optometrists are generally primary eye care doctors, but optometrists can specialize further into an area called vision therapy or vision rehabilitation or neurooptometry. It's a lot of different terms for it. And one neurooptometrist might not do the exact same treatment methods as another neurooptometrist. So you kind of have to figure out what type of treatment options they have. But what we do at our clinic is we look at, is vision supporting reading, learning, driving, work, any activities a patient's doing. And so we look at what glasses or contact lenses would help vision be the most efficient and comfortable. And we also see if there's any underlying inefficiency that could be treated and could be treated through neurooptometric vision therapy, where we're actually retraining the brain to better process vision.
Okay. So you're more in that therapy side of things with helping people outside of maybe a little bit of with the glasses and the lenses, but you're more focused on the therapy side and for maybe more like sensory processing challenges that some kids may have. Is that right?
Yes, exactly. So we're looking to get to the root cause of vision issues and then provide a more permanent treatment. So that's more so targeting how the brain is controlling and processing vision.
Okay, great. Excellent. Well, thank you for the introduction there, but can you give us maybe some common misconceptions that people may have regarding maybe neurooptometry, but maybe just optometry as well? Because I think there's a confusion maybe, and people don't know what the neurooptometrist actually does.
Absolutely. So I find it helpful to have some visuals, since that's my field, is vision. So I'm going to share my screen if that's okay.
Yeah, go ahead.
And let's see. Okay, can you see that eye chart okay?
Yep, sure
okay.
Can.
So every eye exam, this is one of the first tests the eye doctor will do, whether you see an optometrist, an ophthalmologist, or a neurooptometrist. And that's really at 20 feet. That's that first number in the 20/20. What's the smallest line of letters that a person can see? And so the goal is 20/20 visual acuity or better. And so that's, of course, the goal with children as well. And one misconception is that this test is the ultimate test of vision. So somebody could have 20/20 vision, and they're told that they have perfect vision, but that's just visual acuity. And that's one of 35 different areas of vision that we need to effectively process and utilize our vision. So I see a lot of patients that come in, and usually they come to see me with a significant symptom, but they may say, I have perfect vision. And that's definitely not the case if there's another area of vision that's not functioning properly. And luckily in optometry, it's very clear cut. All of our testing is numeric. So each of my tests, usually there's a number or a score for each area, and we'll talk more about those areas. And there's age matched norms. So for a particular age range, we know what's normal in the area of these different areas beyond 20/20 vision. And I'm happy to get more into the other areas of testing that I do and that many neurooptometrists do.
Yeah, I mean, one of 35 different ways you evaluate it, even though somebody's 20/20, it doesn't necessarily mean that they're everything's working the way it's supposed to help them, say, with reading or learning and helping them process the correct information in front of them.
That's right. And that's the one thing about the primary eye care exams. They're really important to making sure that someone is seeing clearly and wearing the appropriate lens prescription if they need it, and making sure the eyes are healthy. You know, those are all very important foundational tests. But as you alluded to, learning is much more complicated. And so a child could have normal visual acuity, or let's say they need to wear glasses and they have normal visual acuity with the glasses on and normal eye health, but still really struggle with something like eye tracking, where they lose their place a lot with reading, for example. So the next area that I like to look at is eye focusing. So just because somebody is seeing a certain size print at 20 feet, it doesn't mean that their eye focusing system is functioning properly. So our eyes, when we look at different distances, our eyes actually have to zoom in and zoom out of focus. And our brain is the one that controls that and tells the eye, the lens within the eye, on where to focus in space. So there's nerves that control muscles that surround the lens. And when we look up close, those muscles actually constrict and zoom into focus, kind of like an old school camera where you had to zoom in and extend that lens to focus up close. And then on the flip side, when we go to look far away, those muscles relax and then our distance vision is clear. And this is particularly important in school because kids are having to quickly look back and forth from their teacher or the board back to their desk. And so sometimes kids have a lag in the near far focusing. Sometimes people have issues with being able to sustain a certain distance. So if they're doing extended reading or near work, which is what most of us do, and the lens cannot maintain a certain focal distance, there might be fatigue or blurred vision or headaches associated with having a near focusing problem. So I'm looking at not just clarity, but also can you sustain that clarity over time with fatigue as well as different distances.
Okay.
And then, yes. And I'm just going to talk about the three main areas. I could go into such great detail in vision, but the next foundational area of vision is binocular vision or eye teaming. So that's the ability for us to aim our right eye and our left eye together. And that offers a single, clear, comfortable vision with good depth perception. But if there's a binocular vision issue, what can happen is if it's minor, there could be blur. If it's more severe, there could be double vision. And over time, double vision can actually lead to something called suppression in children, where one eye takes over and the other eye is actually basically asleep, where the brain's not utilizing that vision. So they have depth perception issues. They might bump into things or get really tired because having suppression is a very tiring process for the brain. So binocular vision issues are also very common. They occur in about 10 to 15% of the population.
Okay, gotcha. Yeah, I had never really realized the impact that the eyes had here in the, say, more of the functional learning process for adults as well as children. So this is pretty cool to be able to do this interview with you and be able to bring this information to more people. So
I'm happy to. It's one of my favorite things is because we all use our vision, and it's so important that vision's functioning properly because we're awake, we're likely using our vision. And people don't realize just how amazing it is in all these different areas. And the thing that fascinates me the most is that it can be improved. So if there is an area like binocular vision, for example, that's not functioning properly, that's what we treat. We can improve upon that with the right learning experiences in vision therapy and the inputs, and giving patients the opportunity to have better depth perception in more controlled scenarios with practice that actually crosses over into the real world. So that's essentially more detail on the process of vision therapy. And that's why I'm in this field, because it's so exciting that you can change your vision and improve it.
Okay, great.
And,
well,
yes.
With seeing, people that have learning challenges or disorders, what are some things that you've seen or like misconceptions as far as what people think of learning challenges and maybe what you can do in your field?
Absolutely. So one of the most, I'm going to stop my screen share, and then if we need to go back to any images, I'm happy to, but One of the most common symptoms or signs of a vision issue in children is actually avoidance of certain tasks. So one common one would be avoidance of reading or avoidance of near work. So avoidance is oftentimes seen as inattention. So the child might look out the window or be distracted. And so a lot of times vision issues are overlooked, and the child might go down this path of getting a diagnosis of ADHD or ADD. And not to say that a child could have both vision issues and ADHD, but I always find that it's most helpful to assess vision when attention issues are suspected, because if there is an underlying vision issue, that's the reason why they're avoiding near work, that's treatable. And so then you can see, okay, well, are there any attention issues left over after vision treatment?
Mm-hmm.
And children with ADHD are also more likely to have binocular vision issues, according to studies, as well as children with dyslexia. So there is a visual processing component that's happening for kids with learning related difficulties. And again, that visual component is treatable in those children as well. So one other misconception that I see, or what we could say misdiagnosis, is sometimes children have a visual processing difficulty, or they may have a binocular vision issue that has them seeing double, and they start to flip words and flip letters because double vision is very confusing, but they don't know how to say, I have double vision. And if they've never really been asked or understand what that is, they may not. So sometimes those children are also misdiagnosed when it's just that their vision hasn't been tested.
Okay, gotcha. And that, I guess that's a bit of a prelude into my next question. What are the more common learning disorders that you may see in your practice that you've had success with?
Absolutely. So those absolutely ADHD and dyslexia and reading difficulties. So all three of those are probably the most common types of pediatric kind of patients that we treat. And like I said, sometimes it's the case that there's a misdiagnosis, and the other times it's an underdiagnosis where they do truly have dyslexia, or ADHD, but there is a visual component that's treatable, and then their learning is better supported because their vision is functioning much more efficiently and it's not interfering as much. We also help kids with autism as well.
Gotcha.
So they can have visual processing issues, especially with overstimulation.
Okay.
And Prism Lenses can help children with autism.
Oh.
So it can help shift space for them. So that's a situation where I may prescribe glasses therapeutically.
And what you're talking about is not necessarily a corrective lens, correct? As far as like the 20/20 type of vision?
Exactly, yes. So of course I want to correct any, we call it refractive error or lens prescription, that's like nearsightedness, farsightedness, things like that. So we correct for that when needed. But therapeutic lenses such as Prism actually shift space. So one example is if a person or a child is really tilting down, you can shift space by putting Prism in an orientation we call base down, and it shifts space up, and it helps improve posture. And it's really a small, slight amount, but it can help just processing in general, help click for them. We also do a lot of Prism therapy in the sessions. So we show them how space can change, and it can help elicit a visual response. So we use them both therapeutically as well as in prescriptions. And so I do a lot of testing to see what kind of prescription, if they need one, would help them function best, especially as it pertains to reading and learning, because those tasks are so visual.
Gotcha. Well, cool. That's great. So from at least my experience, some of these, say autism and some of the learning disorders are pretty complicated, and there's even behavioral issues that follow along with them. So do you work with other providers at times on some of these more challenging cases to, well, they need help with their vision, but they also need help with other areas as well, say maybe calming their sympathetic nervous system down and things like that. Do you work with other providers?
Yes,
Yeah.
yes, absolutely. Especially in the more complex type patients where it's not just vision alone, and usually everything is connected. So if there's developmental difficulties as it pertains to vision development, a lot of times there are other aspects of fine motor skills, or as you mentioned, maybe an imbalance in the sympathetic parasympathetic system. Maybe that happened early on in life that led to developmental difficulties. So absolutely, we work with chiropractors like yourself. We work with occupational therapists, physical therapists, pediatricians. It's important to have a good team. And I think the important part about that is good communication too, because I think these therapies can be very synergistic.
Mm-hmm. Definitely. Okay. Well, great. Thank you for sharing. So if anybody's out there watching this and they want to get a hold of you to find out more of how this might be able to help them or their child, how do they get a hold of you or find you?
Yes, absolutely. So our website is a really great place to get more information. We have a lot on there in terms of these types of vision issues we discussed. Our website, our practice is called the Neurovision Therapy Institute. The website is neurovti.com. And I do have vision symptom quizzes on there if a parent suspects their child might have a vision issue but isn't sure. And then you can also schedule a free consult with me. And usually those are 20 minutes where I can answer any questions that someone might have about vision. And I'm happy to discuss over the phone or email as well. So people can contact us via email at info@neurovti.com. And then our office phone number is 720-408-1400.
You cut out just for a second when you were saying the web or the email address. Can you just repeat that, please?
Oh, sure. Our email is info@neurovti.com.
Okay, great. Excellent. Well, thank you very much for sharing. That was great. Thank you.
Yeah, and thank you for asking such insightful questions. It's really fun to share with the world what we do. So I really appreciate the opportunity.
Yeah, you're welcome. Thank you.
So I would love to transition into asking some questions about you and your practice and what kind of treatment modalities you use. So
Sure. Yeah, I appreciate that.
great. So maybe we could start it with the same way we started mine, where you could talk about your background and the type of practice you have.
Sure. So I am a chiropractor here in Denver with Lifetime Wellness and Chiropractic, but I've been a chiropractor for 15 years and initially experienced chiropractic when I was about 8 or 9 years old. I hurt my back falling on a rock, fishing in a stream, and my mom took me to a chiropractor, and I was pretty active with sports growing up. And so I had some back problems from time to time, and I continued to enjoy the benefits of chiropractic. And I was in college and I wasn't sure what I wanted to do, but I reflected on that, those moments that I had gotten relief, and I liked the idea of helping people, doing it from a holistic manner without drugs and surgeries. I could be my own boss, and just help people enjoy life without pain. And when I was in school, I saw that there was parents bringing their kids in with ear infections, colic, reflux, and torticollis, and like moms coming in while they're pregnant. But also I was seeing there was kids that had like ADHD and some other problems, and I saw them improving, and that got me thinking, like, well, I was thinking chiropractic more from, I think, how most people think of it as like neck pain and back pain, but I'm seeing these other conditions improve. And I was like, that really started me down a path of that I hadn't expected when I went to chiropractic school. And that opened up a lot of doors for me. And when I was working with a mom, she was pregnant, and then she had her child as a premature baby. He was diagnosed with failure to thrive, and we actually started working with him. And after he outgrew that failure to thrive, he had sensory processing challenges. His behavior was definitely out there and a little bit combative. And so she asked if she thought I could help with that as well. I was like, I'm not 100% sure, but we can definitely look at it and see how we can help. And so we found that there was problems in the nervous system that was impacting how his brain was receiving information. And through working with him, it actually changed how he was relating to his environment, and he actually calmed down. He was able to focus better, and he was able to participate more in, like, say, preschool and kindergarten and all those things that he wasn't really able to tolerate well at his age with what his condition was. So that got me to where I'm at now, with helping more from the neurologic perspective versus more of a pain perspective, which a lot of people think of chiropractic as.
That's really fascinating.
Yeah.
That's really interesting, but it makes sense. So I think a good segue is, and I'm very curious about, what's your philosophy when it comes to chiropractic? Because I think that's a really good foundational question to build upon that neurological side.
Yeah. So, everything in our body, from our heart beating, our digestion, working in our stomach, intestines, to our lungs breathing, to even like how our eyes focus, is controlled through our nervous system to one aspect or another. And so, like I was mentioning, I was more brought up initially looking at things from more of a sports injury, pain kind of approach. And I developed a really bad case. It lasted almost 2 months after I was a chiropractor. I had horrible back pain. And it made me realize after I started working with another chiropractor that I knew, that how I'd been approaching things was more just from a symptomatic standpoint, not actually finding the cause of the problem, just more addressing the effect. And so once I started moving away from, say, that sports injury mindset, and I started using that with my patients, I started seeing much better results. People just like they could sleep better, even though they came in, say, for maybe neck pain or headaches, but they were sleeping better. They had more energy. They could focus more. They had better digestion. And so there's like these other holistic benefits that people were having. And so my philosophy is that we're addressing the nervous system in our patient's body, and that's controlling everything. So if we can positively improve that, then it's going to help the person be the best they can be. And at times there's definitely needs for other things, from nutrition to, especially with sensory kids or learning challenges, services like your own. But there's, that's more of my philosophy, is like, we need to address the nervous system and not just say the symptom. We need to, figure out how to improve the way that's functioning to get more holistic wellness in the body.
That makes a lot of sense. It sounds like you're getting to a foundational ability just for the nervous system to function properly, so that you can build upon that.
Yeah.
Right. What would you say is the biggest misconception about chiropractic?
Well, I had it for myself initially, but like chiropractic's only for neck pain or back pain, maybe even sciatica if people think of it for that, or maybe headaches. But there's all these other functions in our body that are controlled through our nervous system, and it can have a tremendous benefit, from kids with colic and reflux to ear infections to even sensory processing challenges. They can see benefits. The way a lot of times when kids come in, or parents bring in their kids for those challenges, they'll have a whole list of other providers. They're doing ABA therapy, they're doing speech therapy, they're doing, OT therapy. Sometimes they're seeing a vision therapist as well. And they ask, well, how can what I do benefit them, since they're doing all these other things, and our time is tapped out already. So we really want to make sure that what we're doing is helpful. And so the way I explain it to them is that we're helping the nervous system be more receptive to its environment. So essentially, if you think of a farmer, if they were to go out to their field and they were to throw seed on their field without tilling the soil, it's not going to have as good of an opportunity to grow a healthy crop. And so what I feel like what we're doing in my office is we're helping to till that soil. So whatever else is going on it is going to be much more impactful, and it's going to have a better chance of taking root and holding with that child.
I like that metaphor. I think that's really powerful.
Yeah.
So how are you able to help people with sensory processing challenges?
Well, I think I just answered that question a little
Yeah,
bit,
you
but
did.
just we're helping to till the soil and make sure that their nervous system can take in the right information and send that to the brain. So then when we get output, that output's now changing and more reflective of what the environment is. So whether it's anxieties, whether it's, trying to be able to focus more, calming them down so they're not as, maybe some kids can have defiant disorders or even obsessive disorders, to name a few others. But it just helps to calm things down, balances their autonomic nervous system so they're not in that fight or flight state. And now they can actually focus. They can actually digest their foods the way they're supposed to. And so that can have so many different benefits for the child or even the adult.
So would you say most children with sensory processing issues are more on the sympathetic side of things in that fight or flight kind of mode?
They tend to be, but some kids are really like go, 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 but then also you can see that they just crash. And there's also some kids that are pretty lethargic. And so some of those ones are more in that on the opposite end of that fight or flight spectrum. But I'd say a majority of them are more in that sympathetic fight or flight side.
But either direction, you can help balance their system.
Yeah, I mean, from what I've seen, that's definitely been the case. I've seen people that have been, I'll just say, more depressed, like they kind of come out of that state, versus people who are more anxious, they're on the other side, and it kind of helps bring them back down as well.
That's wonderful. That's wonderful. Yeah. What does the first session look like for a new patient?
Yeah, well, so if it's a sensory patient, especially a kid, we'll do an initial complimentary consultation with a parent or a patient when they initially are looking to come in. And then from there, if it is a child that they're wanting to get services for, we'll actually do the initial intake process over the phone without the child present. So they're not developing a complex hearing about all these problems maybe that they're experiencing or the parent's concerned about. And that way we get a lot of information without the kid being present or even in the room, like if they're crazy or anything distracting from that process. So we get a really good foundational level before we actually set up an appointment for them to come into our office, then where we can do more of the evaluation in our office to evaluate different parts of the nervous system. We'll even do computerized scans to evaluate the autonomic nervous system and how well balanced that is or not balanced. We'll evaluate gross motor and fine motor. We'll evaluate infantile movement reflexes, as well as some basic ocular motor movements there as well. And that information gives us a better idea if there is problems in the nervous system that are impacting how they're processing their environment in their world. And if that's the case, then that builds the case for us to be able to help them for what we do here in our office with the adjustments and helping to balance the autonomic nervous system and improve the function in the nervous system.
That makes a lot of sense.
Yeah. So yeah, a lot of parents appreciate that approach, since the child doesn't have to be there and they can have an open line of communication without kind of guarding what they're saying.
Right. I always say I don't like talking about the child while the child is there. It's not okay. So I like that you separate the two and you try to get the history before the child, you do the evaluation with the child. So I think that's really smart.
Yeah.
So I think this leads us to the final question, which is just how do people connect with you that are interested?
Sure. Yeah, our website is a great source as well, and that's denver-chiropractor.com, and it's the hyphen dash. It's not spelled out or anything. It's just the symbol, and they can schedule an appointment there, or they can find our phone number to be able to reach us, and it's 303-399-3569, and I'll chat with them over the phone for a complimentary consultation as well, just to make sure it seems like it's a good fit and they can get questions answered so they don't feel like they aren't aware of what to expect when they first come in. Because a lot of times I think people schedule appointments, but they haven't even had a chance to talk to the doctor or even let alone know what to expect when they go in. So I like to be able to make sure that happens.
Great. Great. Well, thanks so much for answering all my questions. I think it was very eye-opening what you do. And yeah, I'm excited to work together more.
Yeah, definitely. Thank you, Dr. Talaber.
Thank you.
Yeah.